Hello, everyone. This is Anna Maria Tirano. I'm the Vice President of Marketing at Cincy. Welcome to today's webinar, Customer Use Cases Highlighting How Messaging and Video Improves Patient Communications and Engagement. Please note that attendees are muted during today's presentation. However, there is a chat window at your disposal, so please type your question that you will have and we'll review the questions submitted at the end of the webinar presentation. Today's webinar is being recorded. After the webinar concludes, we'll make the recording available not only on our website, but you will receive an email with a link to the recorded webinar. Today, I'm pleased to be joined by Tom Albano, Manager of Professional Services at Cincy. Prior to Cincy, Tom oversaw implementation at CareCloud and Meditech. At Cincy, Tom works closely with many of our customers in the initial deployment and ongoing implementation of the Cincy communication platform. He is our resident road warrior. Right now, he is actually dialing in from Utah, and he is working hand in hand with many of our customers in the initial implementation, ongoing utilization, making sure that they are using the Cincy platform as widely and as deeply as they can in their organization. Our webinar presentation will highlight how our customers are using HIPAA-compliant messaging programs and video visits to make a difference in patients' outcomes, home health clinicians' productivity, and their agency's bottom line. We will showcase our customer use cases, such as wound care management, chronic care support, pre- and post-op services, and palliative care and hospice care. Virtual care really can improve patient expectations pre-discharge by preparing them for future changes. A recent study published in the Journal of Post-Acute and Long-Term Care Medicine highlighted a few interesting points. Almost all patients, 96% of patients, actually expressed a preference to receive discharge information either before or at the time of discharge. And more than half of them indicated that discharging hospitals' preparation for receiving home health care was inadequate. As a result, their expectations unfortunately exceeded what home health care agencies are naturally designed to do. For example, 2/3 of patients expected extended hours of caregiving, such as additional hours, daily care, overnight care, etc. This communication gap obviously results in hospital and patient misconceptions and a lot of dissatisfaction that can result. As one of the study's participants noted, patients, as well as their family caregivers, expect that we will be there every day for hours at a time and we can stay overnight. Now, virtual care has a great role in helping to bridge that gap and minimize kind of the confusion as to the role that home health agencies play in preparing patients from their transition from inpatient to outpatient, as well as for those patients who are being referred by physicians. Hospitals and home health agencies can use a virtual care platform to collaborate and agree on the next steps for the patient before the patient is discharged from the care facility. As well as home health agencies, our customers are actually using Cincy to introduce themselves to the patient before the patient even leaves the hospital virtually via video. And then once at home, the home health agency's administrators are using our platform to schedule a series of patient-directed communications promoting medication adherence, as well as serving as reminders for upcoming in-person or video-based visits. By engaging key stakeholders before and during the episodes of post-acute care, agencies can resolve communication gaps in real time while amplifying the role of home health care in helping patients transition. Who is using technology? Almost everyone. The share of Americans that own smartphones is now 77% in 2018 versus 35% in 2011. And almost 70% of baby boomers actually have a smartphone or are using one on a daily basis. I am now happy to pass the reins over to Tom, who will talk more about the role of a communication platform and start the presentation on our use cases.
Thank you, Anna Maria. I appreciate the introduction. So as Anna Maria mentioned, I lead our professional services and implementation team. So I travel the country and work with all of our clients to get them up and running on the Cincy platform. At Cindy, we work with health systems, home health care agencies, hospice agencies, palliative care agencies, visiting nurses associations, and even some health plans to help enhance their communication with patients. I've had a lot of great experiences working with nurses, physicians, therapists, care managers, intake specialists, and even more to really understand how patients are engaged across the healthcare spectrum. With that being said, Cindy is a very effective means of connecting parties and engaging patients throughout their care. Whether it's a nurse connecting to a patient, a clinician connecting to a colleague, or a clinician connecting to the patient's caregiver, the Cindy platform allows for all of these parties to connect throughout the patient's care. In addition to that, technology continues to improve, and many of these technologies are well suited for the healthcare space. As Ana Maria mentioned earlier, nowadays almost 70% of baby boomers own a smartphone. And that number alone doesn't even include text-capable devices such as flip phones that many of the people in that generation own and use on a daily basis. With these enhancements in technology and the increase in the number of patients who have access to technology, Cindy has targeted a device-agnostic world where all forms of smart technology can seamlessly connect with one another. So whether it's a laptop, an iPad, a tablet, a smartphone, or even those flip phones, using Cindy, you'll be able to reach and engage these patients using various forms of video and messaging communication. The cool, fun, and flashy part of the Cindy platform is the ability to conduct HIPAA-compliant, secure virtual video visits with both your patients and their colleagues. Using Cindy's virtual video engagement platform, nurses can easily connect to patients for scheduled supplemental check-ins and monitoring. The video capabilities can also be used in situations where the patient is experiencing a minor issue, needs a second opinion, or is experiencing anxiety about their condition. We have a number of organizations who also use our video capabilities in an after-hours triage environment to get a set of eyes on the patient before determining if a nurse needs to be dispatched out to the patient's home. This can save organizations a significant amount of time and money. We recently released our caregiver functionality, which allows you to seamlessly integrate a patient's caregiver into a conversation via virtual video visit. Whether it's the patient's mother, father, spouse, child, home health aide, or even power of attorney, these individuals can easily be added as a third party to an existing virtual visit or can be remotely brought in to engage the patient's care from afar as the nurse, the therapist, or aide is in the home of the patient. This often helps put the patient at ease and can make the decision-making process faster and more succinct. The video capabilities also work incredibly well from a colleague-to-colleague perspective. While the nurse, the therapist, or the home health aide is in the home of the patient, using Cindy, they can connect back to their colleagues. Whether it be a wound care specialist, a specialty provider, a case manager, a therapist, or even just a more seasoned member of their team, they'll be able to connect with these individuals for a second opinion. In addition to our video capabilities, the Cindy platform also utilizes 3 different types of messaging that can be used in various capacities. The first one, our secure messaging feature that you can see on the screen, will allow you to engage in real-time secure chatting communications. This feature can be used between colleagues and also from provider to patient. Our app-to-app security and encryption allows you to send PHI-related information in real time, so condition-specific and medication-specific details or questions can be addressed through this medium. Our on-demand messaging routine allows you to send both text and email notifications to your patients. These communications go directly to the native messaging app or email account on the patient's device, so the patient can receive this type of message without having to download or learn a new application. Many of our clients have had success sending welcome messages, call us first notifications, appointment reminders, provider arrival notifications, flu shot reminders, and severe weather preparedness alerts, just to name a few. We'll go into a lot more detail on that a little bit later on. The third type of messaging is our patient program messaging routine, which allows you to sequence messages and automatically send them out over a defined period of time. Many of our clients have had success sending condition-specific tidbits and reminders out to their patients concerning CHF, COPD, wound, diabetes, and many more. Whether it's a 15-day span, a 30-day span, a 60-day span, or even more, you get to determine exactly what messages are going out to your patients and in what time frames those patients are receiving those messages. The patient program management routine uses the same text and delivery channels as the on-demand message routine does, so patients constantly have this information at their fingertips and they're consistently reminded of what they need to do to stay on top of their care. So as we move into the next slide, I really just wanted to call to attention some of the use cases our clients are utilizing with our on-demand contact routine. To give you a quick idea of some of the things that our clients are using today, they send out welcome messages, provider appointment arrival messages, dietary reminders, tuck-in programs, which seem to be a hot topic as of late, call us first notifications, flu season reminders, weather alerts, and so forth. Right, and to give you a quick idea of what some of these messages may look like, from a provider appointment arrival standpoint, instead of making a phone call and receiving the patient's voicemail, you have the ability to send on-demand messages out to the patients, informing the patient that you're going to arrive within a certain window. So as an organization, you could send something along the lines of, greetings from Cincy Health. Your provider, Jenny Smith, RN, is scheduled to arrive between 2 o'clock and 2:30 tomorrow. Please be ready for your appointment. If you have any questions or need to reschedule, please give us a call at phone number. All right, so short and sweet, it's going to go directly to the patient's device, and the patient will have that right there at their fingertips. Another example is that tuck-in program that I mentioned earlier. This is seemingly a hot topic as of late, but essentially it would give you the ability to send all of your patients a text or email notification on Friday afternoon, reminding the patient that your agency is available to them all weekend long. So something along the lines of, the weekend is here. Did you know that at Cincy Health we have nurses available 24/7 to assist you? Nights, weekends, and holidays, we're always available. If you need any assistance or have any questions about your care, feel free to give us a call at 123-123-1234. We'll be able to get in touch with your doctor should you need assistance. Obviously, each one of these messages will be branded with your organization's name and phone number instead of the generic Cincy Home Health and the generic phone number I listed a second ago. Okay. Another common on-demand message type is going to be tied into severe weather, whether it's a hurricane, an earthquake, fires in the area, really anything that you want to mass send messaging about to your patients, you absolutely have the ability to do that as well. One of our clients in Florida recently sent out a message to all of their patients to prepare them for hurricane season. That message said something along the lines of, it's hurricane season, and Cincy Health wants to make sure you're hurricane ready. Your supply kit should include first aid items, water, batteries, a battery-operated radio, flashlight, and non-perishable food. Try to have a week's supply of oxygen and medications on hand. Please don't wait to refill them. If you need any additional information or support, please contact our team at. So as you can see, there's a lot of neat things you can do with that on-demand messaging routine. And again, that's going directly to the patient's device that they use on a regular basis. And they're all branded with your organization's name and your phone number. So now that we've talked about the different means of engagement and communication the Cincy platform offers, I want to start to discuss how some of these features are being used in real-life environments. I want to start with wound care because a number of our clients are having success in this area. So as you all know, wound care is an incredibly expensive and temperamental beast that requires constant and careful attention. Millions of chronically ill patients throughout the country have wounds. Once a patient develops a wound, healing can be complicated by many comorbid conditions associated to the patient. These wounds amount to over $20 billion in documented care costs annually. In addition to the complexities of wound care, a national shortage of certified wound care specialists in the home care space has placed a great burden on many home care agencies. Using Cincy, our clients have been able to remotely engage, regionalize, and in some cases nationalize their wound care specialists. Instead of sending wound care nurses all over the region or state, using Cincy, our organizations have been able to remotely engage these patients either directly from the patient's device, as the patient is alone in their home changing their dressing, or from the nurse's, therapist's, or home health aide's device as they are in the home dealing with the ailing patient. With this workflow, costs associated to the specialist transportation or even the patient's transfer and or readmission are minimized. productivity is maximized as one wound care specialist can provide guidance virtually to all caregivers in the field. This is especially important in rural areas. In rural situations, nurses and specialists can spend a lot of time driving instead of being able to treat their patients. Using Cinzy's virtual care capabilities, you can really bridge the gap between education and wound assessment. Using Cinzy, we also have the ability to send pertinent and timely text or email reminders to the patient. We mentioned this earlier using our patient program management system. These reminders can really help keep the patient on top of the important aspects of their care and the things they need to monitor. Again, these messages can be customized or cadenced to suit the needs of your patient population and organization. In the example above, we see excerpts from a multi-touchpoint patient program spanning 60 days. These messages are carefully crafted and positioned to ensure the patient is privy to all they need to be aware of. As you can see in the slide, we see excerpts here from that 60-day program. We have the messages from day 1, 4, 8, and 30. And you can see in between, we see on days 5 and 6, whether it's a virtual visit, a secure message, or even an in-home visit, all of these programs are supplemented using the different forms of technology that Cinzy offers. But as we go through this program, you can see on day 1, the first message upon enrollment really just alerts the patients of things to look out for regarding their condition. So you can see in this particular case, it reminds the patient to call us right away if you experience any increased drainage, bleeding, foul odor, increased swelling, or a number of other infection-related symptoms. 4 days later, the patient receives a message reminding them of the importance of taking their medications regularly, and not just to take them when they feel sick, but to complete that medication sequence as instructed by their provider. If we skip ahead to day 8, you can see that that message informs the patient that keeping the wound clean, warm, and moist is ideal for the promotion of healing. Right, and then we skip ahead to day 30 in this particular case, again, just reminding the patient of what to look out for, common symptoms, and of course, each one of these messages is branded with your organization's name and phone number, so the patient is always aware of where to go and what to do when they need assistance. These messages are incredibly easy to craft, and they often serve as a strong supplement to the educational materials our organizations have traditionally given out to their patients. With that, I'm going to pass the reins back to Anna Maria so she can talk through some of our direct client feedback, especially related to wound care.
As one of our customers pointed out, virtual visits truly facilitate a successful start of care and the initial assessment between the RN at a patient's home and the wound care specialist. These virtual visits aid in the reduction of secondary and tertiary visits by the wound care specialist, obviously saving in a lot of transportation costs, time related, and as Tom had pointed out, it really frees up. It increases the productivity of the WCN to care for that many more patients. The use of video technology also helps ensure the quality of the care. One of our partners praised the efficiency and effectiveness of Cinzy's video and shared that a lot of time is spent looking at pictures, and the quality of pictures is typically poor. Plus, it takes a while for the WCN to get the picture via email. But with Cinzy, the ability to see the wound live, see it virtually, is as good as being there in person. And in another example, Cinzy's platform has helped a client, specifically Accent Care, identify an opportunity to save thousands of dollars on a single patient. In this scenario, during a video consultation, the wound care specialist actually noticed that the home health aide was about to change out bandages that looked brand new. The patient and the RN were changing the bandages out on a daily basis instead of a weekly basis and recognized they were changing them out obviously too fast. The nurse was able to consult with the wound care specialist regarding how the patient is utilizing supplies, and they discovered that the patient mistakenly went through 7 weeks worth of supplies in 1 week. That equates to thousands of dollars. And this was an opportunity to really do the best thing for the patient, which obviously improves the bottom line and outcomes for all. With a virtual care communication platform, our customers are helping their patients receive more expedient evaluation and assessment by clinicians with specialized wound care training. Patients are engaged. Using the Cincy platform, we're seeing high rates of the communications being received, opened, read, and most importantly, acted upon. And one of our clients reported results in terms of increased operational efficiencies, lowered rates of readmissions and ER visits, improved no-show rates, and most importantly, it's all back to the outcomes, stronger outcomes that lead to greater satisfaction for the family, for the patient, for your team of clinicians, and of course, leading to additional referrals from institutional and community sources. Recently, Dr. Greg Sheff, Chief Medical Officer at Accent Care, spoke to Home Healthcare News about Accent Care's positive experiences using Cincy. The initial program, which targeted wound care patients, has helped Accent Care cut costs and reduce readmissions for participating offices. As a result, the program is now in a larger rollout. In this interview, Dr. Sheff cited impactful results such as in an office that's running, in general, an 11% hospitalization rate, this population, with this intervention, meaning Cincy's platform, had a 4% rate. By removing the travel time, specialists can broadly share their experience across the geography more efficiently. It's a very efficient way to give care. We think it has a very positive return on investment. Tom, I'll turn the reins back to you.
Thank you. So I want to spend a few minutes here talking about COPD next. So as you all know, COPD is another high-flying condition in the home healthcare space. There are a number of statistics out there that outline the expenses and costs associated to COPD treatment and care. Recent studies show that costs attributing to COPD were $32 billion in 2010, and these costs are projected to grow to almost $50 billion by 2020. It's also well noted that 1 in 5 patients with advanced COPD are readmitted within 30 days of discharge. With that being said, many of our partners are targeting both COPD and CHF because of that incredibly high risk of rehospitalization. Education, compliance, and stabilization are just some of the goals for home health clinicians when they're caring for patients with COPD. With the use of a virtual care communication platform, such as Cincy, home health clinicians can conduct virtual visits and schedule a series of ongoing communications via email, text, or secure message. These messages can provide additional education and motivation for the patient surrounding medication compliance. They can guide the patient through at-home exercises with tips and feedback. They can enable patients to ask questions in real time, and they can also share diet and lifestyle guidance on a regular basis. Using a combination of video-based virtual visits and ongoing text messaging communications, Cincy's virtual care platform can help home health agencies reduce the risk of complications, reduce the risk of rehospitalization, and stabilize the patient while improving his or her quality of life. As we move on to the next slide, I really just wanted to call out a common cadence for some of these programs. So as you can see in the slide, we have 2 calendars, and each one of those orange boxes indicates the date a message would be sent. Of course, all of these cadences can be customized to suit your organization or your patients. But in many of the examples we provide, you can see that the messaging up front is fairly heavy. That way we can get the pertinent information out to the patient right away, whether it's medication reminders, dietary reminders, what to look out for, and even just awareness about your home health agency and your phone number. As you can see, as the cadence goes on, the number of messages is reduced. But again, you're still going to be able to provide pertinent information to that patient. The cadence is just slowing down as the patient's ready and used to what they need to be doing to help themselves along the way. On the next few slides, we're going to take a deeper dive into our COPD-related program. So if we take a look here at slide 1, this really has the first 12 touch points in our COPD program. Notice that the cadence here is really once every 4 days. And the patient's alerted of things that are pertinent to their condition. As you can see, the first message calls out key symptoms that the patient needs to be aware of, very similar to what we saw in the wound care example earlier. And of course, each one of these messages is branded with your organization's name and phone number, so the patient knows exactly who to call and what to call for. The day 4 message in this particular case outlines quick tips and tricks that will reduce the likelihood of the patient becoming short of breath. These messages will remind the patient of what they can do to help manage their condition, and it may also spark conversation topics the next time the nurse is in the home of the patient. If we move along to day 8, we can see a very similar medication reminder that we saw in the wound care program. And then on to day 12, we can see that we're reminding the patient to avoid smoke at all costs. This is something that's thoroughly discussed with the patient during admission, but again, it can never hurt to remind the patient of what to look out for, especially in the case of COPD patients. Cigarette smoke, secondhand smoke, even smoke from fires are all detrimental to their care and their well-being. If we move on to days 16 through 30, you can see our program is starting to space out. So instead of that every 4 days, we're now up to every 5 days. Within this example, the patient's consistently reminded of things such as diet, exercise, activity, and breathing exercises that will help the patient manage his or her condition. All of these messages are intentionally written in a very highly engaging manner in an effort to motivate the patient to comply with each one of these messages. And as we move along to the third slide here, we get down to days 40 through 60. In days 40 through 60, again, our cadence is now up to 10 days per message. And we see some additional breathing exercises, a condition management message again to remind the patient, and even a flu shot reminder to make sure the patient's on their toes about what they need to do to stay healthy. Something as simple as don't forget about the flu shot. It's an easy thing to overlook, but getting the flu shot once a year is essential to maintaining a healthy lifestyle. As you can see, very high level, very engaging, really just putting emphasis on what the patient needs to do in an effort to stay healthy. So a quick case study here to highlight one of our customers' experiences using Synzi to show you the effects that Synzi can have on COPD patient care. In this particular case, a male patient was having difficulty breathing, and he was a frequent flyer to the ER. The traditional action would be to send a respiratory therapist out to the patient's home. In this particular case, the home health agency incurs the cost, the liabilities, and the time associated with sending the therapist or a nurse out to a patient's home. Using Synzi, our partner was able to utilize the virtual video component of the platform, connect to the patient on their own device, and discuss breathing and coughing exercises via video. The respiratory therapist was successfully able to assist the patient without having to drive 2 hours round trip, and they were able to prevent the patient from going to the ER. In addition to the ER cost savings, some of the secondary benefits are that the respiratory therapist can see more patients in a shorter time frame by not having to drive all over the region. Patient satisfaction was also increased due to immediate and timely care via Synzi technology. With that, I'm going to pass the reins back to you, Ana Maria, to talk about diabetes and CHF and how Synzi can help support these patients.
Thank you, Tom. Patients with diabetes can experience frequent hospital readmissions. In fact, the 30-day readmission rate for hospitalized patients with diabetes is estimated to be between 14 and 23%, a higher rate compared to the readmissions rate for all hospitalized patients. Home health agencies play a pivotal role in treating patients with diabetes and helping to reduce readmission rates by providing patients with education, self-management, and motivational support. After discharge, the patient can benefit from a home health agency's care in order to adopt and maintain a healthy lifestyle, including the correct nutrition and appropriate exercise. Also, address emotional challenges in making necessary lifestyle changes, manage risk factors, maintain a steadfast commitment to blood sugar monitoring with frequent blood glucose testing, and understand the role and need for medication or insulin injections. A unified virtual care platform What Cincy can do is really help with these clinician-to-patient communications as well as the care coordination. As our customers tell us, it is invaluable to making sure that everyone is on the same page, whether it's the home health agency staff, the patients, providers, such as endocrinologists or PCPs, as well as the patient's own family caregivers. Using video, home health clinicians can more frequently engage patients in virtual visits and see how the patients are monitoring their blood sugar and administering insulin. The video-based interactions can also be used to discuss how patients can confront complications due to aging, lifestyle changes, and progression of the disease. Pharmacists and providers can be included in these virtual visits if medication reconciliation is needed and/or if the patient presents with an emerging issue that really needs immediate intervention from an outside specialist. In addition to conducting virtual visits with patients, the home health agency uses the Cincy platform to schedule and send frequent communications. These secure messages remind patients to monitor their blood sugar levels and adhere to diet, exercise, and lifestyle guidance. The patients themselves express that they appreciate the continued care and the continued support provided in the cadence of touchpoints. And the family, the caregivers themselves, whether they're close by or far away, appreciate the ability to always be included in their loved one's video-based virtual visits, as well as seeing how the messaging is going to learn how their family member is progressing. With Cincy's communication platform, our home health agency customers are helping patients with diabetes receive the ongoing support they need to better manage their condition and minimize the risk of readmission. Heart failure is a common clinical syndrome associated with high morbidity and mortality. Outpatient disease management is critical. It's absolutely crucial for patients with heart disease, as 83% of patients hospitalized at least once and 43% are hospitalized at least 4 times. One of the most critical and challenging issues for home health agencies, as well as the broader healthcare ecosystem, is to find innovative approaches to reduce the high hospital admission and readmission rates of these patients. Controlling the frequency and/or severity of rehospitalizations is also critical to maximizing the quality of life for the patient while managing the cost of care. In this situation, Cincy really plays a crucial and important role for home health agencies to better partner and engage their CHF patients. Video-based virtual visits allow agency clinicians to review the patient's condition, address barriers and issues to lifestyle changes, and also reconcile medications in real time. Emails, secure messages, they can be used in between the virtual visits on a very structured basis, similar to what Tom had gone through with the wound care management protocol. These messagings are serving an important role in teaching patients behavioral modifications, encouraging exercise and physical rehabilitation, reinforcing dietary adjustments and nutritional needs, and of course, educating patients about their condition, their medications, with the goal of improving compliance. By maintaining frequent contact with these patients, above and around in-person visits, home health clinicians can adjust patient care as needed and quickly intervene if the patient's situation needs immediate intervention. Better management and engagement of these patients are helping our customers minimize the number and length of hospital stays, leading to improvements in quality of life as well as cost of care. I'll turn it over to Tom, who will talk about how Cincy's platform is helping our customers in terms of pre-op and post-op guidance.
Thank you, Ana Maria. So I wanted to spend a few minutes talking about both the pre and post-op use cases, since we've had a lot of success with our clients utilizing Cincy to engage their patients in both of those situations. They can use Cincy really to better prepare their patients for the procedures and ensure the patient is recovering well in the post-op scenario. Utilizing Cincy to engage patients both pre and post-op has really proven effective for generating more successful outcomes for your patient. Instead of sending the patient back and forth to the hospital or the outpatient facility, using Cindy, you can remotely engage the patient via video visit. This goes a long way from a patient satisfaction perspective because the patient can now spend less time driving back and forth to the facility, waiting in waiting rooms, and missing work or school appointments. In doing so, they're also able to take these calls from the comfort of their own home. Using Cindy, you can also send pointed reminders to ensure the patient is prepared for their procedure. We'll dive into a little bit more detail later on, but something as simple as greetings from Cindy Health. This is just a friendly reminder that you have an appointment tomorrow at our main campus facility, 200 Central Ave, St. Petersburg, Florida. Please arrive 30 minutes early for your appointment and remember not to wear anything metal. Please also stay hydrated before your appointment. If you have any questions, call us at. So you can see in this particular case, a short and sweet message that's going out to the patient is reminding the patient of their appointment. It's indicating the address, because in many cases there's multiple buildings or places the patient may have to go. And it's reminding them of pertinent things that apply directly to the procedure the patient is going to go through. So using these technologies, especially in the pre-op scenario, can even help alleviate patient anxiety before procedures and also assist patients with any special requirements prior to their procedure. Cindy's virtual visit platform also provides the opportunity for patients' out-of-town family members to become involved in their loved one's care. This can really go a long way in alleviating the guilt often associated to not living close enough to provide that hands-on support. So you can see in both the pre and the post-op case, there's a number of pieces of functionality that the Cindy platform offers that can really go a long way in making the patients and their loved ones' lives easier. So as we move on to the next slide here, you can see a number of different reminders that can be sent out to patients. I read through one earlier, but I just wanted to give you a quick glimpse into what some of our clients are sending out to their patients. As you can see, some of the more common reminders are things such as reminding the patient not to eat or drink anything after midnight, reminding the patient to stop taking certain types of medications in the days leading up to their procedure, reminders for what to wear and what not to wear, whether that's deodorant, perfume, metal, or anything along those lines, and even hydration reminders scattered in there as well. All this is incredibly important so the patient is prepared for their procedure, and your associated organizations are going to be very happy with the preparation of these patients as you get them ready for their procedures. Again, all of these messages go out directly via text or email, so the patient's going to receive them immediately, and they're going to be prepared for their procedure based on the messages you send them. Using these reminders in combination with the video visits has really gone a long way for reducing no-shows, and it significantly increased the patient preparedness prior to surgery. If we take a look at another quick case study here, I want to highlight sort of the post-op scenario. In this particular case, one of our clients had a female patient who was experiencing a normal post-op condition, but the patient was still weary and anxious about that symptom. The typical action would have been to send the nurse out to see the patient. Again, in this particular case, the home health agency is incurring the cost, the liability, and the time associated to the visit. Using Cindy, the patient was able to connect back to the home health agency's triage team. A typical phone call would not have been enough to ease the patient's anxiety because the nurse would not have been able to actually see the patient's wound via telephone. Using the video capabilities, the patient was able to show the nurse exactly what the wound looked like, and just having that sense of eyes on the wound really put the patient at ease. A big deal to a patient is often not all that big of a deal to a nurse who's used to seeing these conditions on a regular basis, and the nurse in this particular case was able to put the patient at ease. The obvious benefits in this situation are the avoided ER visit, as well as the associated travel and time savings. But again, the patient satisfaction of a quick turnaround using the enhanced video care and the avoidance of a night spent in the ER waiting room really enhance the patient's overall satisfaction with her home care agency. So palliative care is another area where our clients have had success in improving patient satisfaction, reducing travel time, and travel costs. The goal of palliative care, of course, is to improve the patient's lifestyle to make them feel as comfortable as possible. The combination of Cindy's virtual video visits and messaging cadences can go a long way in doing just that. Effective palliative care results from ongoing communication and management of the patient's symptoms, status, and ever-changing needs. Using Cinzy's virtual care platform, home health staff can conduct virtual visits with their patients, nearby family members, distant family members, and the patient's PCP. Video-enabled check-ins can help the palliative nurse identify symptom escalation and functional decline in real time and respond accordingly with the appropriate care. On-demand access to care helps patients and caregivers get the answers they need or the support they seek when they experience problems in caring for the patient and they're unsure of what to do next. Utilizing our text messaging and email communications, our partners have also been able to increase their patients' feelings of support and connection with their home health providers, decreasing their fear, their depression, and their anxiety during their pain and symptom management. Another use case I want to share with you involves our caregiver functionality. One of our organizations was able to use our caregiver functionality to pull in a concerned family member from across the state. Using our caregiver functionality, as we mentioned before, caregivers such as spouses, parents, sons and daughters, power of attorneys, etc., can be seamlessly brought into a virtual video visit. As long as that caregiver has a smart device with an internet connection, a camera, and a microphone, those individuals can be virtually brought in from anywhere in the world. In this particular case, a daughter who was very active in her mother's care was unable to attend all of her mother's visits in person moving forward. The daughter was feeling guilty about not being as heavily involved in her mother's care. She had previously taken days off of work and spent hours behind the wheel driving back and forth to see her mother as the nurse was in the home with the patient. Using Cinzy, the nurse was able to virtually pull the daughter into each visit so that she could listen into her mother's care and feel incredibly more connected to her. In this case, in addition to the transportation savings costs, utilizing Cinzy allowed for quicker care decisions. Instead of waiting for the daughter to connect to her mother after each visit, she was able to answer questions right away. It also significantly increased patient satisfaction and reduced anxiety, as the patient was always able to feel as though the loved one was in the room with her and the nurse during the care. The last use case I want to talk through is hospice. So home telehospice provides many of the typical services delivered in patients' homes through video, email, and secure messaging. By using virtual care technology, nurses, along with the broader hospice care team, can significantly enhance their communications with patients and the patient's caregivers. Virtual care can deliver many additional benefits, including quicker assessments of patients, faster availability for timely interventions, and greater teaching opportunities for family members or caregivers. The use of a virtual care platform also optimizes available hospice care resources, especially in communities with a shortage of trained specialists and/or rural areas where visiting nurses are traveling greater distances to reach their patients. This technology enables providers to care for more patients and increase access to hospice care services. Using Cinzy's virtual care platform, timely instructions can be provided to family members or caregivers, helping them relieve a patient's discomfort in real time. This prevents agency staff from having to make late night or after hours in-person visits. Family and caregiver anxiety is also alleviated as they are virtually shown how to provide the right kind of care and support during this very challenging time. Remote family members can also be incorporated into these video calls. Thus, the compassionate care and comfort is delivered both to the patient and his or her loved ones throughout this very difficult time using our virtual platform. If we take another look at a case study, this particular case study involves a son supporting his father who was on hospice care. While visiting with his father, the son noticed a higher than normal blood pressure level. The typical action in panic mode for the son would have been to call 911 and have the patient go back to the hospital for a rehospitalization. But using Cinzy, this particular son was able to connect to the hospice agency's triage nurse and show the nurse the elevated blood pressure level. The nurse was able to educate the son and inform him that the recorded blood pressure value was high for a typical healthy patient, but for a hospice patient like his father, it was within the normal range. Since the patient was able to see the nurse's reaction and her calm nature via video, the son was able to reciprocate this mentality and not escalate the situation. In this particular scenario, the video capabilities allowed the patient's loved one to truly see the nurse's calm mannerisms and nature, and this really put both the caregiver and the patient at ease.
What does this mean for our home health agency customers? Our customers are finding that Cinzy's virtual care communication platform is helping patients be more mindful and motivated in their ability to better care for themselves at home in between visits. In terms of being mindful, Cinzy's platform helps the patient better understand his or her condition, treatment plan, and role in managing their health going forward. Because the patient can access care from his or her home and at a time when they really want to stay home and they want their quality of life to improve, they're much more engaged in the guidance that comes out every few days, whether it's secure message or it's virtual visit. Providers also use the video-based virtual visits to really bring to life, especially the treatment plan and the discharge protocols and the medication guides going forward while discussing it within the context of the patient's routine at home. In terms of motivation, healthcare organizations are really recognizing the benefits of using secure messaging, text, and email to communicate appointment updates, medication dosage and refill reminders, and diet lifestyle recommendations to their patients. This really eliminates a lot of the back and forth that most agencies typically deal with when they use the telephone to call patients to confirm times, dates, etc. for upcoming appointments. With Cinzy's platform, home health agencies can program automated appointment reminders instead of dedicating valuable staff time to calling patients and encountering the phone tag. Technology is also helping the patients become more effective at being kept in the know as to what's coming up and how they can take care of their health on a daily basis. Across our customers, we are seeing high engagement results in terms of agencies, messaging, and virtual visits for key conditions such as those we talked about today, as well as for the initial welcome message. As we discussed today, the Cinzy platform really positions an agency for success. Success based on its ability to improve overall outcomes while also lowering the overall cost of care, such as related lengths of stay and readmission rates, while strengthening patient engagement. Using our platform, home health agencies are experiencing a 40% increase in referrals and being able to provide better care at better margins. With Cinzy, our home health agencies customers are more competitive and, most importantly, more successful in delivering on the referral partners' goals of providing patient-centric yet cost-contained care. I'd like to thank Tom today for sharing our customers' experiences and insights regarding the use of Cinzy's HIPAA-compliant messaging and video to address patient needs. With Cinzy, our customers are able to increase referral sources, strengthen patient engagement, and most importantly, improve overall outcomes. Feel free to visit our website at cinzy.com to learn more, as well as to reach out to us to schedule a demo and understand how our platform can work within the workflow of your home health care agency.